You're watching Local 10, home of Local10.com. WPLG Local 10 News at noon starts now.
All right. Well, more and more women are being diagnosed with cancer during their childbearing years, which can force their plans for a family to be put on hold.
But there are ways to preserve your fertility, and we'll tell you about them when Local 10 News at noon comes right back.
Every year, about 130,000 women in their reproductive years are diagnosed with cancer. But the fight against the disease leaves many infertile and unable to have a baby. But as Local 10's Christy Kruger reports, with the help from fertility experts, many young cancer patients are finding ways to preserve their fertility and also fulfill their dreams of having a family.
Mary Cook Martell was just 34 years old when her doctor discovered a lump in her breast and sent her for a mammogram.
To my surprise, the fast word is I had breast cancer.
Although surgery, chemotherapy, and radiation were all necessary, the young newlywed was fearful about how all that would affect her fertility.
I was actually more confident about getting past the cancer. I was more nervous about how are we going to have a family.
The front of the embers are right here.
Okay. Mary turned to Dr. Moshe Perez, a fertility expert, who helps both men and women preserve their fertility prior to undergoing cancer treatment.
Well, with men it's pretty easy. I mean, you know, you just obtain the sperm, and you count the sperm, make sure the sperm count is adequate, and you freeze it. You do a couple of those, and at least you keep it in the bank, and it can be kept there indefinitely.
We told him at Thanksgiving, so that was like a big surprise.
For women, the process of collecting eggs requires using hormones to stimulate the ovaries, which also carries a risk for cancer patients.
There are certain protocols that we use in which we're using anti-estrogens. Instead of just stimulating the ovaries using anti-estrogens that also have a stimulatory effect on the ovary to produce eggs, but actually achieve much lower level of estrogen.
Once the patient's oncologist gives the all clear, the ovaries, eggs, or sperm can be unfrozen for implantation.
But many times a decision the woman makes because there's no doctor who can guarantee to her that she's not going to have a recurrence of cancer.
2.5 years after treatment, Mary's oncologist recently gave her the green light. She went through one in vitro cycle with the eggs harvested prior to her cancer treatment and is now pregnant with twins.
I'm elated. I mean, my husband and I, we waited a long time, and our friends know, and everybody couldn't be happier, you know, and the fact that it's twins was an added bonus.
Another option for women receiving chemotherapy is a hormone that puts the ovaries into temporary menopause. Doctors can also surgically relocate those ovaries to protect them from radiation treatment. With your health news, I'm Christy Kruger, Local 10 News.
Well, the wheels of love were spinning on The Bachelor